Have you started? Just check. Okay, start. Hello, welcome back, guys. Hello, welcome back. Good evening, everyone. So, in yesterday's class, what we have discussed, we have seen about the muscle physiology. We have seen how muscle contraction will occur. We have seen the structural proteins in the muscle. We have seen the sarcolemmal proteins, the proteins which are present in the muscle membrane. Also, we have discussed about the T tubule, L tubule. We have discussed about the sliding filament theory, how muscle contraction occurs. We have seen the regulatory proteins like troponin, tropomyosin, okay, actin, myosin, power stroke, cross bridge formation. All those things we have seen in the last class. Now, in this today's class, let's discuss. Okay, now in this today's class, let's discuss about the blood physiology. Okay, some important basic points which you should know in your first years of the blood physiology. Okay, so in this blood physiology, I will be discussing about the blood cells, RBCs, WBC platelets, and the main important, the gist of this topic. Okay, which is important for your exam. In exam, see, in exam, there is a chance that you can get a questions from RBC, WBC platelets. I will mainly concentrate on those MCQ points, like in exam, what they will ask you, what are the important areas that I will mainly concentrate. But the most important topic in this today's class is hemostasis. Okay, hemostasis, sir. How the blood is going to clot. Whenever there is a damage to your blood vessel, whenever there is a vascular injury, whenever there is a vascular injury, damage to your blood vessel, how clotting will occur. And if there is no clotting, that will lead to bleeding disorders. That I will discuss today. So first, let's start with the basic points. Now, in the basic points, which topics you should know is, look, so hematopoiesis. What exactly is hematopoiesis? Hematopoiesis means, in the name itself, it's there. Hemat. Hemat means blood. Poiesis means production. Hematopoiesis, blood production. So, when blood production will start to occur in us, when the hematopoiesis will occur. Blood is not just the RBC cell, WBC platelets, other cells are also there. So, when exactly this hematopoiesis will occur? Say, hematopoiesis will start even when we are an embryo. It starts from embryo stage. Embryo stage. See, when you are a small embryo, 3 weeks. 3 weeks embryo means almost 20 days, right? 21 days. 3 weeks means 21 days. So, in and around 20 days, 20-day embryo, small embryo, you are a small embryo. At that time itself, the hematopoiesis have started. Okay, so where in your body hematopoiesis have started? Do you know where the production of the blood cells have started? Do you think it's a bone marrow? No. Do you think it's the liver? No. It's in a structure called as yolk sac. In anatomy, you will study that. In embryology, you will study that. What is exactly is yolk sac? But in physiology, I'm telling you that there is a structure called as yolk sac. Okay, say in this yolk sac of the embryo, somewhere around 19-20 days, most of the books mentions on 19th, around the 19th day. Okay, erythropoiesis have started. Okay, erythropoiesis have started. First, that's the first site of erythropoiesis. So, what is the best answer? The best answer for erythropoiesis is first site is yolk sac on which day? 19th day. Okay, on 19th day, sir. TK. Sir, after yolk sac, around at the same time, after yolk sac, certain mesodermal structures. Okay, certain mesodermal structures. Do you know what are they? Sir, the mesodermal structures like aorta, the blood vessel, aorta, sir. Aorta and gonads. I think you know gonads. Gonads are testes and ovaries, gonads. And even the mesonephros, the primitive kidneys. Okay, mesonephros. So even these structures can produce your blood cells, RBC, WBC platelets. Okay, so by 3 weeks, which structures are producing the blood cells? So first structure to produce the blood cells is yolk sac, somewhere around 19th day. After the yolk sac, even the mesodermal structures, those structures which are originated from the mesoderm, a germ layer. I hope you have studied it in your class 11th and 12th. Three germ layers will be there: ectoderm, endoderm, mesoderm. So the mesodermal derivatives like iota, gonads, and mesonephros, they can produce the blood cells. Okay, by 3 to 4 months. 3 to 4 months. Now you are a little big embryo. You are a little big embryo. 4 months have completed. So around 3 to 4 months, liver. Okay, sir, liver, sir. The hematopoiesis will start to occur in the liver, spleen, and lymph nodes. Okay, mainly the liver cell. So liver, spleen, and lymph nodes, they can produce the blood cells by 3 to 4 months. So by the time of the birth means 9 months. Okay, you are a 9 months completed, term gestation completed. Now you are taking your birth. Okay, so by the time of birth, now hematopoiesis activity is exclusive to bone marrow. Bone marrow now only in the bone marrow RBC production, WBC platelet production is occurring. So by birth, bone marrow. Okay, bone marrow cell. And by the time of the puberty, okay, by the time of the puberty, puberty means what? Adolescence by 14, 15 years. Okay, 13, 14, 15 years, you are getting into the puberty. Okay, reproductively active age. Okay, so you are getting into the puberty. Now, during puberty, what happens is the hematopoiesis is going to be seen in, yes, of course, bones, but seen in membranous bones. It is seen in membranous bones. So now you'll get it out, sir. What exactly are these membranous bones? What exactly are these membranous bones, sir? See, membranous bones means not radius ulna. See, these are the long bones. Okay, radius ulna. These are the tibia. These are the long bones. Now, during puberty, the erythropoiesis, or I should say the hematopoiesis, is now limited to the membranous bones or flat bones, not the long bones, flat bones. Okay, I will show you the image which is down over there. Okay, I will show you there also. But remember, in puberty, the membranous bones are the main structures for hematopoiesis. What are the membranous bones? Vertebra. Okay, vertebrae, sternum, sternum. These are like flat bones. These are the flat bones, vertebra, sternum, and ribs. Okay, so in these bones, hematopoiesis is occurring. Now look at this image. This image is very important for understanding purpose. Now, say around, or I should say before, even before first month, that is somewhere around the third week. Okay, somewhere around the third week. See, hematopoietic activity is in where? In the yolk sac. In the yolk sac. Now after the yolk sac, see somewhere around 3 4 months, see it's the spleen and the liver. Okay, time, see after the yolk sac, the hematopoiesis is occurring in the spleen and liver. Okay, now after 9 months, that's the birth. That's the birth. What is happening? So after the birth, say majorly the hematopoiesis is happening in the bone marrow. Bone marrow of which bones? Long bones as well as flat bones. Long bones as well as membranous bones. But after the birth, look. So the hematopoietic activity in the long bones, like femur and like tibia, these are the long bones, right? Now the hematopoietic activity is going to come down. See, gradually with age, the hematopoietic activity in the long bones is decreasing. Okay, but look, so the hematopoietic activity is going to be high in vertebra, sternum, and in the ribs. Okay, ribs. It's continuing. It's continuing. See, of course, yes, I can agree with you. Okay, look at this image. See, the hematopoietic with the increase in age, we all know that blood production will decrease. With increase in age, the hematopoietic production, the blood production is decreasing, gradually decreasing. Okay, even in vertebra, sternum, ribs, it is falling down. But majorly with increase in age, as you guys are getting older and older, the hematopoietic activity is going to be mainly limited to the vertebra, sternum, and ribs. You know the vertebra, sternum. This is the bone. Okay, this is the bone, the breastbone, sternum, and the ribs. Ribs. Okay, so that's the point which I want you to know, sir. Right? Next. After this, what else I should teach you? Okay, after this, what else I should teach you? Is they go, guys. Now, my question to you. So, from where this hematopoiesis is occurring, from where the hematopoiesis is occurring? So, hematopoiesis is occurring something from the bone marrow. Now, who is producing this blood? Who is producing the blood, sir? See, the blood is produced by certain stem cells. Stem cells. In our bone marrow, there are hematopoietic stem cells. Okay, in our bone marrow, what is there? Hematopoietic stem cells are there. These hematopoietic stem cells, what they will do is, you need to understand. Say, imagine this is one hematopoietic stem cell. Okay, what are stem cells? You should understand. Imagine this is a stem cell. Okay, stem cell. Now, when the stem cell, when it is dividing, okay, when it is dividing, do you know what happens? It is going to actually its own cell type, same exact copy. Okay, exact copy. Okay, this is mother stem cell. This is the daughter. This is the daughter stem cell, and it is producing one more cell, but this is not a stem cell. This is differentiated cell, means of other cell type, so what I'm trying to put into your mind is, are in your bone marrow you are having stem cells, lots and lots of stem cells are there. Those stem cells, while they are giving rise to new blood cells, while they are giving rise to new cells, they maintain their own population, for example, think like this, sir. This is a stem cell, sir. Okay, this is a stem cell. Now this stem cell, when it is dividing, for example, imagine it is dividing and it is forming the RBC, for example, say RBC. It is not going to occur just like that, for understanding purpose. So this is a stem cell. It is forming the RBC. It is forming two RBC. Khatam. Now RBCs are produced. Now what happened to the stem cell? Now stem cell is gaya. Stem cell gone, sir. Totally, it was gone. Means within 1 month, all stem cells will be completed. For example, 1 month or 3 months, all the cells are completed. There are no more stem cells left. If there are no more stem cells left, then how can you produce your RBC, WBC, and platelets? So they have to maintain their own population while dividing these stem cells. Yes, these stem cells, they will give rise to new structures. Okay, but while dividing, they maintain their own population. These cells should maintain their own population. Okay, so that's what is important. Look here, ये देखो, this is stem cell here. How the stem cells will divide? Okay, see, the stem cells are dividing. There are two types of stem cell division. Actually, there are three types are there, but for understanding purpose in your first year, this is enough. So symmetrical division, which means one stem cell is going to divide into two stem cells. Same. Okay, no maturation, no differentiation. One stem cell is divided into two stem cells, sir. Maintaining its population or increasing its population, stem cell count is going to be increased. Okay, that's good. Sometimes what happens is, now I have explained you, stem cell, this is asymmetrical division. What is this asymmetrical division, sir? Now this one stem cell, it is a dividing into its same type daughter stem cell and one differentiated cell. So even after this division, the stem cell is still present. With this stem cell, it's going to again divide into one more stem cell and one more differentiated cell. So by this way, they are maintaining their population. Okay, stem cells are maintaining their population, sir. Okay, so stem cells are what? They can give rise to new cells by maintaining their own population. That completed. Now after this, what I should explain you is the stem cell classification. Types of stem cells. Okay, types of stem cells. First, let me explain you here. Look, right? Types of stem cells. Yeah, what exactly are these types of stem cells? What are the different types of stem cells? The first stem cell type that I'm writing here is called as totipotent stem cell. Next, pluripotent stem cell. Next, multipotent. So the three important types are totipotent, pluripotent, multipotent. ये क्या है? What exactly are these, sir? See, totipotent stem cell means this is a cell. For example, see, देखो, this is one cell I am showing you. Okay, this is one cell I am showing you. So this one cell can give rise to whole organism, whole human. See, if you put this stem cell, if you culture it, or if you put it in the uterus, you just take this and put it in the uterus. It will create an entire new human being. Even the placenta, entire human being is going to be produced. Okay, so such a cell is called as totipotent stem cell. Totipotent stem cell. Okay, so totipotent stem cell can give rise to whole new human being. Okay, it can form each and every organ cell along with the placenta. Even the placental growth will occur. Okay, now for understanding purpose, as you guys are, many guys are like, even like not yet joined in the MBBS. Now let me give you a basic understanding. Sir, this is the ovum which is produced by the mother. Okay, that's the ovum which is coming from the mother. Okay, that's the ovum which is coming from the mother. And from the father, what's going to come? This is the sperm cell. Okay, this is the sperm cell with the acrosome. Okay, now this is ovum. This is the sperm. So the ovum and sperm, when they meet, they are going to form what? They are going to form a structure called as zygote. It's going to form a structure called as zygote. So this zygote, it will divide. It will divide. Okay, now it's dividing, and now there is this embryo cell. Now there is this embryo. This is how many cell stage? One, two, three, four, five, six, seven, and let's put one more cell, for example, here, like this. So this is an embryo now. It is dividing. So till this eight cell stage, now this embryo. Now eight cell stage. Now each and every cell. Now from this embryo, it's having how many cells? Eight cells. Okay. Now you take these eight cells, separate them. Okay, separate these eight cells. Now you can make a total complete human beings from this each and every cell. Okay, this each and every cell, you just take them, you just separate them and put it in eight different uterus, in eight different females. Same type of human being is going to come. Eight different types. Like I should say eight different types. Eight human beings will come, sir. Completely formed. Heart, brain, like muscle, skeletal, everything is going to be there. So each and every cell is having a potency to develop the entire human being. So this eight cell stage embryo, each and every cell is having totipotency. Totipotency, sir. They can form entire human being. Okay. Yeah. Next. So after this eight cell stage, now further divisions will happen, right? Further divisions dividing 8 will become 16, 16 will become 32, something like that. So you are going to be left with a structure like this, sir. You are going to left with a structure something like this. So now, yes, this is also embryo, sir. But now what is the stage of this embryo? You are having a water filled cavity here. There is a cavity. Okay. Now this embryo is called as a blastocyst. This embryo is called as a blastocyst. Now this blastocyst cells, now these cells, each and every cell which I am showing you, these blastocyst cells. Now I am taking this one blastocyst cell. Now this blastocyst cell is an example of pluripotent stem cell. It's called as a pluripotent stem cell. So what exactly is this pluripotent stem cell? Now, so each and every cell, now it cannot form entire all the structures. See, even this pluripotent cell, like it can almost form every structure in the human. Okay, all it can form all three germ layers. The structures belonging to all three germ layers. Now, human is forming from the three germ layers, right? So almost entire human will form, sir. But these blastocyst cells, they cannot form one structure, that is a placenta. Okay, they do not form the placenta cell except placenta. No placenta. Except placenta, it will form the entire human being. Okay, pluripotent stem cells. So totipotent stem cell example is this zygote. You can say this zygote. Zygote is an example of totipotent stem cell, or the embryo, 8-cell stage embryo. That's an example of totipotent cells. They are example of totipotent cells. Then what are the pluripotent stem cells? Pluripotent stem cells, they can form all three germ layer structures. Okay, the structures which are coming from the three germ layers, ectoderm, endoderm, mesoderm. Okay, all the derivatives of the three germ layers can be produced except placenta. Okay, so now let's discuss about the multipotent stem cell. Okay, now look at this in this table itself. I will show you. Sir, totipotent stem cells. What are the examples? See, embryonic stem cells, zygote, 8-cell stage. Okay, they can differentiate into any cell type, even the placenta. Pluripotent stem cells. Okay, pluripotent stem cells say they can differentiate cells into any of the three germ layers. Okay, now multipotent stem cells. So, what is the example of multipotent stem cell? Now, hematopoietic stem cell, which is present in the bone marrow. I am telling you, in our bone marrow, in our bone marrow, हमारा bone marrow में, in our bone marrow, there are hematopoietic stem cells. Sir, these hematopoietic stem cells, what they will do? Sir, the hematopoietic stem cells, they can form all the blood cells, RBC, WBC, platelets, okay, T lymphocytes, B lymphocytes, neutrophils, all cells. This hematopoietic stem cell, this is the one cell. It can form different types of cells. Maybe it's not forming your central nervous system. Maybe it's not forming your heart, or brain, or muscles, but it can form different types of cells. Maybe it is not forming all the structures from the three germ layers. It is capable of forming different types of cells, all types of blood cells. This hematopoietic stem cell form all blood cells. Okay, one cell, it can form all types of blood cells. Okay, so that's why they go here multipotent stem cell. Example is hematopoietic stem cells. The hematopoietic stem cells are multipotent. Okay, now when compared to totipotent, and when compared to pluripotent, now see what is happening. The differentiation capacity is getting decreased. Totipotent can form the entire organism along with placenta. Pluripotent can form the entire organisms without placenta. When you come to multipotent, it can form multiple cells, multiple cell types, but not all structures. Okay, so like this. So these are some important points which I want you to know. Only point which I want you to remember is hematopoietic stem cell is an example of multipotent stem cell. Hematopoietic stem cell is an example of multipotent stem cell. Okay, it's an example of multipotent stem cells. Okay. Now, here what I have to teach you is that I have said to you from this multipotent stem cell, hematopoietic stem cell, all cells will form RBC, WBC, platelets will form. How, sir? How? That I will explain you now. Okay, that I will explain you now. So let's begin with the hematopoietic stem cell. Okay, in the bone marrow there is hematopoietic stem cell. Okay, so now tell me it is multipotent. It's a multipotent cell. Okay, hematopoietic stem cell. It's a multipotent, right? Here itself I am writing. It's a multipotent. Okay. So this hematopoietic stem cell, whenever it's required in our body, whenever the hematopoiesis is required, every day it's happening, of course. Now this hematopoietic stem cell, now do you know what it's going to divide? It's going to divide into, now it is dividing, sir. Hematopoietic stem cell, it is going to, it can divide into common progenitor cell. It will form, okay, it will form common myeloid progenitor means precursor cell. Okay, common myeloid progenitor into one cell, and it can also form the same hematopoietic stem cell. They go. Now you need to understand, guys. Don't confuse. See, imagine this is a hematopoietic stem cell. Now when you stimulate it, okay. Now what it is forming? It is going to divide something like this. It is going to divide into its same cell type, stay same type. Okay, and it is also dividing into myeloid precursor cell, common myeloid progenitor cell. Okay, this is common myeloid progenitor cell. So it always maintains its own population. I am not going to tell it again and again. Okay, it always maintains its original population, sir, main population. Okay, just I am erasing this now. So tell me, sir, hematopoietic stem cell, it is going to form common myeloid progenitor. What it is going to do, I will explain it. And also it's going to form common lymphoid progenitor. Common lymphoid progenitor. A common myeloid progenitor, common lymphoid progenitor cell. Now, this common myeloid progenitor, later on, whenever this common myeloid progenitor, when you put some chemicals onto it, okay, when you expose this common myeloid progenitor cell to certain chemicals, which chemical, sir? I will tell you. Okay, which chemical? The chemical is called as granulocyte monocyte, GM, granulocyte. You can write in your books, okay, granulocyte, monocyte, colony stimulating factor. This is a chemical. Okay, this is a chemical, or I should say cytokine. So, when you expose the common myeloid progenitor cell to granulocyte monocyte colony stimulating factor, now it is going to form, it's going to form granulocyte, granulocyte colony forming unit, CFU, granulocyte colony forming unit. It's a cell, sir. It's a cell. Granulocyte colony forming unit is a cell. And see, granulocyte, monocyte, I have told you. So it's going to form monocyte colony forming unit, MCFU. So granulocyte colony forming unit, monocyte colony forming unit. So try to understand. Now what happened? Hematopoietic stem cell, it is divided to common myeloid progenitor and common lymphoid progenitor. The common myeloid progenitor, when it is exposed to granulocyte monocyte colony stimulating factor, now the common myeloid progenitor is going to divide into granulocyte colony forming unit, monocyte colony forming unit. Now this granulocyte, remember here, see this GCUF, granulocyte colony forming unit. Now from this one single cell, you are going to get the granulocytes. All the granulocytes will come from this one single cell, sir. Now, guys, do you know what are granulocytes? Granulocytes are which blood cells? Neutrophils. Okay, neutrophils as well as eosinophils and basophils. Okay, so neutrophils, eosinophils, and basophils, they are all produced from granulocyte colony formation, colony forming unit. Now you can ask me, sir, when a granulocyte colony forming unit is going to turn into, we will produce neutrophils, when it will be converted into eosinophils, and when it will be converted to basophils, based on the chemicals, based on the type of chemical acting here, they will change into different cell types. For example, I will explain you. See, look, I'm writing here. Sir, whenever this granulocyte colony forming unit, whenever it is acted upon by a chemical called as granulocyte colony stimulating factor, granulocyte colony stimulating factor. Okay, granulocyte colony stimulating factor. Whenever you put this chemical here, it is going to form the neutrophils. Or if you keep interleukin 15, okay, interleukin 15, this interleukin 15 helps in the production of eosinophils. From granulocyte colony forming unit to the eosinophils, you need to have this chemical called as interleukin 15. Okay, and when this granulocyte, see, on this granulocyte colony forming unit, if you put interleukin 3, interleukin 3, now this granulocyte colony forming unit is going to form the basophils. So based on different types of chemical signals, the granulocyte colony forming unit is going to form different types of granulocytes like neutrophils, eosinophils, and basophils. Okay, so what are all these? These are your WBCs. These are your WBCs. Now, simple monocyte colony forming unit. In the future, it is going to form monocytes. So now you have understood, right? See, neutrophils, eosinophils, basophils, monocytes. From where are they coming? From where are they coming, sir? They are all coming from one single cell. That is common myeloid progenitor. From the one single common myeloid progenitor, all these WBCs are coming. Neutrophils, eosinophils, basophils, monocytes are coming. But which WBC is not there? Lymphocyte. They go. Lymphocyte is not there. T lymphocytes, B lymphocytes. They are not at K. They are not at K, sir. Okay. Okay. So now let's discuss about them also. Okay. Let's discuss them about them also. Now look. Let's discuss about the common lymphoid progenitor. Okay. Common lymphoid progenitor, sir. Actually, I have to add here one more thing. Okay. Actually, I have to add one more thing. Common myeloid progenitor. Okay. Here I have to add one more thing. Just let me take this and put it this side. Okay. Actually, forgot to draw one more thing over here. This common myeloid progenitor. Okay, common myeloid progenitor. It's going to form granulocyte, monocyte progenitor. So actually, here one small thing is missing. Let me erase and just it's almost same thing, but I need to add one thing. Okay, look here. This common myeloid progenitor. It's actually divided into granulocyte, monocyte progenitor. Just you will understand. It's a small change. Small change. Right. Let's put it this way. Here, let me adjust. Yeah. So first, this common myeloid progenitor, it is going to divide into, yeah, granulocyte, monocyte. See, GM is granulocyte, monocyte progenitor. Okay, granulocyte, monocyte progenitor. Now, from this granulocyte, monocyte progenitor, see, they go granulocytes, monocytes are coming. Okay, it's a common myeloid progenitor. The common myeloid progenitor is first divided into granulocyte monocyte progenitor. From that granulocyte monocyte progenitor, this granulocytes, monocytes, all the granulocytes, that is neutrophils, eosinophils, basophils are coming. But that's the one thing which I have forgot to mention here is, sir, it is also forming, okay, from here, it's also forming one more cell lineage, that is erythroid, okay, erythroid megakaryoid progenitor. Erythroid megakaryoid progenitor. Okay, erythroid megakaryoid progenitor. Okay, now in the name itself, it's there. You can easily understand erythroid from which RBCs are going to come. Megakaryoid, megakaryocytes are going to come. That's the platelets. Okay, so common myeloid progenitor is going to divide into again for understanding purpose. Okay, if you got anywhere confused, again I'm explaining. So common myeloid progenitor, it is going to divide into granulocyte monocyte progenitor as well as erythroid megakaryoid progenitor. Now, this granulocyte monocyte progenitor is going to divide into granulocyte colony forming unit, monocyte colony forming unit. Now, the granulocyte colony forming unit is going to form the neutrophils, eosinophils, basophils. Monocyte colony forming unit is going to form the monocytes. Monocytes. Now, this erythroid megakaryoid progenitor cell, this erythroid megakaryoid progenitor cell, it is going to divide and forms. It is going to divide and forms two types of cells. What are they? Simple RBC and platelets, RBCs and platelets. See, in between many stages will be there, but I am not writing. So simply now you have understood, sir. All our see, they go RBC, platelets, and majority of the WBC, neutrophils, eosinophils, basophils, all are coming from who? It's the one ancestor cell, sir. It's the one cell. It's the one progenitor cell. That's the common myeloid progenitor. From this one common myeloid progenitor, neutrophil, basophil, eosinophil, RBC, platelets, everything is coming, sir. Monocytes, everyone is coming. Then you can ask me, sir, what are left over? The B lymphocytes, T lymphocytes. So they will come from common lymphoid progenitor. From the common lymphoid progenitor, who can come now? That I will discuss now here. Sir, from this common lymphoid progenitor, this common lymphoid progenitor is going to divide into, right? It's going to divide into two cell lineages. So two cell types. It can form two cell types. What are they? B cell progenitors, B progenitor cells, B progenitor cells as well as T progenitor cell. T or NK. T cell, NK cell progenitors. NK for natural killer cells. B cell progenitor as well as T cell or NK cell progenitor. See, this B cell progenitor cells, they will divide and forms the B cells in the presence of interleukin 4, in the presence of interleukin 4. Okay, in the presence of interleukin 4. Now these T cells or NK cell progenitor cells are going to divide into T lymphocytes, T cells, and natural killer cells, NK cells. Okay, T cells and natural killer cells in the presence of interleukin 2 and interleukin 15. Interleukin 15 cell. Interleukin 2 as well as interleukin 15. So what I have explained here, so the common lymphoid progenitor cell is one single cell. Now it can form, it having a potency, it is having a capability to produce the B progenitor cells, T or NK progenitor cells. The B progenitor cells, whenever there is interleukin 4 is there, when interleukin 4 is acting on the B progenitor cells, they will be converted into B cells. B lymphocytes, B lymphocytes. Now, the same way, the T or NK progenitor cells, whenever they are acted upon by these interleukins like interleukin 2 or interleukin 15, they can form T lymphocytes or natural killer cells. Natural killer cells. So, all blood cells are formed or not? Yes, sir, all blood cells are formed. So, they go RBC, neutrophils, basophils, eosinophils, basophils, monocytes, B lymphocytes, T lymphocytes, natural killer cells, platelets. Everything is formed. So it's a one single cell type. It's a one single cell. It's a hematopoietic stem cell. It is having a capability. It's having a capability to divide into different types of mature blood cells. It's a one single cell which can form RBC, WBC platelets. That's why it is called as a stem cell. Okay. While it is forming a differentiated cell, it will also divide into its own type and maintains the cell population. That's why years together, 50 years, 60 years, 70 years we are living. But still the hematopoietic stem cells in our bone marrow, the number is maintained, sir. Okay, so here I have explained how different types of blood cells are forming. Okay, now after this, let's discuss about one by one important points about different types of cells. Okay, which I want you to know here are first RBCs. Let's talk about the RBCs. So regarding RBCs, what are RBCs? Red blood cells. Okay, red blood cells. Now, basic points about the RBCs. Now, if I show you an RBC, something like this, very important thing is what is the diameter of RBCs? What is the diameter of RBCs? Okay, 7.2 microns. Okay, 7.2 microns diameter of the RBCs. RBCs are having which shape? Biconcave shape. What is the importance of this biconcave shape? Biconcave shape. So we are having small capillaries in your eye. You can see the small capillaries. Now through such a small capillaries, you have to send the RBCs. You have to send the blood. Okay. So if RBCs are round, they cannot easily pass. If they are having the shape, see they go. It's a shape, sir. Now this biconcave shape is going to be giving the flexibility to RBCs. Now because of this biconcave shape, RBCs are now flexible. They are flexible. They can easily go through the sinusoids. They can easily go through the capillaries so that they can pass through the blood vessels. Okay. Now, what is the volume of the RBC? If you look at the volume, the entire volume, what is the volume of the RBCs? The volume of the RBCs is measured in femtoliters. Femtoliters. The normally the volume of the RBCs are 80 to 90 femtoliters. 80 to 90 femtoliters. Okay, 80 to 90 femtoliters. If the RBC size is, for example, now in certain diseases like especially anemia, iron deficiency anemia, the RBC size is going to become less than 80 femtoliters. Then it is called as what? Then it is called as microcytic RBCs. Microcytic RBCs. If the RBC size is more than 100 femtoliters, then it is called as big RBCs. Macrocytic RBCs, macrocytic RBCs, big RBCs. They are seen in the disorders, certain disorders, like anemias especially. In microcytic anemias, the size of the RBCs is less than 80 femtoliters. In macrocytic anemias, the size of the RBCs will be 100 femtoliters. Why the size is increasing and decreasing? That's pathology we'll study. Okay. Now, after this, in RBC topic, I want you to know. See, look here. I have explained you. From where RBC is coming? Sir, I have simply shown you from erythroid megakaryoid progenitor cell. Simply I have shown you RBC is coming like this. But actually, in between here, there are many stages. There are many stages. 7 stages are there. 7 stages are there. So these are the stages. 7 stages. 7 stages in the production of the mature RBC. So the first stage in the production of RBC is called as a proerythroblast. Okay, proerythroblast. The first cell, this is called as a proerythroblast. Now this proerythroblast, now it will be divided into basophilic erythroblast, or this is also called as early normoblast. Early normoblast. Okay, early normoblast. Erythroblast, you can call it as a normoblast also. Now, this basophilic erythroblast or early erythroblast is going to divide into polychromatophilic erythroblast. Polychromatophilic erythroblast, also called as intermediate normoblast. Okay, intermediate normoblast. Now, this polychromatophilic erythroblast, it will divide and it will form orthochromatic or orthochromic erythroblast. This is called as late normoblast. Okay, it's also called as late normoblast. So early, first you are having what? Proerythroblast, early normoblast, intermediate normoblast, late normoblast. The point which I want you to know is, sir, in which stage hemoglobin production is there? In which stage hemoglobin production is there? Dekho, hemoglobin synthesis. Okay, hemoglobin synthesis. So hemoglobin synthesis have started in intermediate normoblast. In intermediate normoblast stage, hemoglobin synthesis have started. Okay, now here from here they go even now the red color is appreciated. Now you can have the red color from now it's getting reddish. Ortho. Okay, orthochromatic or orthochromic erythroblast. Now they become visibly red. But here itself hemoglobin synthesis have started. Okay, here itself hemoglobin synthesis have started, but red color appearance have started to appear from late normoblast. Late normoblast. So at the late normoblast stage, you can see the cells as reddish in color because more hemoglobin is getting produced. And if you look at the cell, the nucleus is becoming smaller. Okay, here see, देखो, such a big nucleus is there. Such a big nucleus is there. Okay, now with the subsequent cell divisions, what is happening to the cell size? Now, as the cell divisions are increasing from proerythroblast to basophilic erythroblast, polychromatophilic erythroblast, orthochromic erythroblast, as the cell divisions are increasing, now size decreases. The size is going to decrease. The proerythroblast, blast cells are immature cells. What exactly is the name blast referring to? Blast means immature cell. They are bigger in size. Now, the RBC mature RBCs are smaller in size. With the more subsequent divisions, the size of the cells are going to decrease. Now, important point is, see, the nucleus size is also decreasing with the time, with the divisions. The nucleus size is also decreasing. And last, see, in orthochromatic or orthochromic erythroblast, see, the nucleus is becoming smaller and smaller, condensed. The nucleus is getting condensed. Pycnotic nuclei, small nuclei. Okay, nuclei is becoming smaller. Okay, so this is the last stage where you can see the nucleus. Now, after this stage, the nucleus is going to be removed. Okay, after this stage, now when the cell is dividing, the nucleus is kicked away. The nucleus is totally removed from the cell. Now they become reticulocytes. Okay, so reticulocyte is one stage before erythrocyte, mature RBC. So in reticulocyte, what happened is, say, extrude the nuclei. Okay, extrude the nuclei. The nucleus is removed. Okay, the nucleus is removed, sir. Okay, the nucleus is removed. So in one of the exams, this question was asked how to stain the how to find the reticulocytes. How to find the reticulocytes. So these reticulocytes will take a special stain. They are stained with a special dye which is called as brilliant cressyl blue or new methylene blue. New New methylene blue is the stain or a dye used to look for the reticulocytes. Used to look for the reticulocytes. So now just tell me the what are the stages? Proerythroblast, early normoblast, intermediate normoblast, late normoblast, reticulocyte, and finally it is the erythrocyte. Final mature RBCs are called as erythrocytes. Erythrocytes. Now you know it. All important points about erythrocytes: biconcave in shape, 7.2 micrometers in diameter, 80 femtoliters in volume. Okay, you know it. Okay, the same things. Here, the same things, whatever I have explained you, I have explained you the same things. From here they go. It's the proerythroblast. Next, basophilic erythroblast. Erythroblast is called as normoblast. I have explained you. So, proerythroblast, basophilic erythroblast, polychromatic erythroblast, orthochromatic erythroblast, and last reticulocyte and erythrocytes. Okay, देखो, see how big the progenitor cells are. The stem cells are bigger in size. Okay, with the subsequent cell divisions, देखो, what is happening? Cell size is decreasing. These are reticulocytes. These are mature cells. Now this is the last one, sir. This is late normoblast where there is pycnosis. Pycnotic nuclei is same. Condensed, absolutely condensed nuclei. So this is pycnotic nuclei. Okay, done. So I have shown you different stages in the erythrocyte production also. Now let's talk about important points about the RBC. Some other important points about the RBCs. What are they? So RBCs are having which protein inside the RBCs? There is a pigment. There is a pigment. Okay. What is that pigment? Hemoglobin. That hemoglobin, it's a pigment. Of course, it's a protein, but as it is giving color, as it is giving red color to the RBCs, it's called as a pigment. Sir, this hemoglobin, it is made up of what? A hemoglobin. What exactly is this hemoglobin, sir? See, in the name heme is there as well as globin is there. So, this hemoglobin, it consists of four heme and one globin. Okay, four heme molecules will be there, and one globin protein will be there. Okay, globin is a protein. Heme, what is heme? Heme is inorganic substance. This globin is organic substance, organic thing, protein. Okay, now you look here. I'm showing the structure of hemoglobin. Okay, here I'm showing you the structure of hemoglobin. Now here they go, the central molecule, these are the four heme molecules. Okay, here I'm showing you four heme molecules. Okay, so hemoglobin consists of four heme molecules. Okay, now I'm taking one heme molecule. For example, one heme molecule I'm taking and I'm showing you. See, look here. It's a pigment, hemoglobin pigment. I hope you have already studied this in your class 11th and 12th, because hemoglobin structure and chlorophyll structure will be same. Will be same, sir. Almost same. Like you have studied this in your botany, right? So in the center of the heme molecule there is iron. The center of the hemoglobin there will be, I think, magnesium will be there. Okay, so I'm not sure. I'm not sure about it. But anyway, so this is how the heme is there. Heme in the center of the heme. There is iron, they go. There is iron. That's why hemoglobin, for the production of hemoglobin, we require the iron. Why? Because iron is the central molecule in the heme. The heme. Okay, sir. So this heme, they are surrounded by this protein. They are surrounded by this protein. So what is that protein? The name of that protein is called as globin. Okay, the name of that protein is called as globin, sir. Okay, so four heme molecules and globin molecules are also there. Okay, now look here. I'm showing you, sir. This globin is actually of two types in adults. In adults, there are two types of globin chains. There are two types of globin chains: alpha globin. Okay, alpha globin and beta globin. Alpha globin and beta globin chains. So how many types of globins are there? Alpha globin as well as beta globin. Alpha globin, beta globin. Now, why this is important? Why I'm saying about alpha globin, beta globin? Because see, we have different types of hemoglobin. When you are an embryo, you have a different type of hemoglobin. After birth, in a fetus, there is a different type of hemoglobin. Okay, I should say, like, not after, just after birth. Embryonic stage. In embryonic stage, different type of hemoglobin is there. During fetal life. During fetal life. Okay, still in the uterus. During fetal life, there is a different type of hemoglobin. And as an adult, in me, there is a different type of hemoglobin. So that they will ask in your exam. See, heterogeneity, yeah, heterogeneity of human hemoglobin. Different types of hemoglobin are there. Now, when you are an embryo, so there are three embryonic hemoglobins. There are three types of embryonic hemoglobins. What are they? Hemoglobin Gover 1, Gover 2, and Portland. Hemoglobin Portland. Sir, what is the difference? What is the difference? Heme is same, sir. Heme is same. But which chains are there? Okay, which type of globin chains are there? Where are they alpha globin chains, beta globin chains, gamma globin chains, or epsilon, or zeta? Which chains? Based on which chains? So in Gover type 1, so there are two zeta chains. Okay, in a normal adult, I have shown you. This is the normal adult hemoglobin. In adult hemoglobin, two alpha chains are there, two beta chains are there. Two alpha, two beta chains are there. Globins, two alpha globins, two beta globins are there. Okay, two alpha globin chains, two beta globin chains. That globin. Globin is a protein. But when you are an embryo, so you are having, this is zeta. The symbol is the zeta. Zeta. Okay, two zeta, two. They go two zeta and two epsilon. Two zeta and two epsilon. And there is one more type of embryonic hemoglobin, that is 2 alpha. This 2 alpha, it can bind with 2 epsilon. 2 alpha and 2 epsilon, if they are there, means that is called as a Gover type 2. 2 zeta and 2 gamma chains, if they are present, means that is called as Portland. So actually it's an order. This is the order. This is the order. Means hemoglobin will change with the time. With the time, hemoglobin will change. First Gover 1, next the Gover 1 will be converted to Gover 2. Gover 2 will be converted to Portland. So Portland is going to convert it to hemoglobin F, means hemoglobin is the fetal hemoglobin. Okay, fetal hemoglobin, sir. Now, in this fetal hemoglobin, see there are two alpha chains, there are two gamma chains. Two alpha chains, two gamma chains. It's a fetal hemoglobin. Even in adults, even in us, in you and me, so there is little amount of fetal hemoglobin. There is a little amount of fetal hemoglobin is present in you and me also, sir. Okay, but in us as adults, the main hemoglobin. Okay, not this one. Sorry. In adults, what is the main hemoglobin? The main one, that is hemoglobin A. Hemoglobin A. It's mainly present in our RBCs. The main. So it consists of what? Just now I have shown you this one. Two alpha chains, two beta chains. Four heme molecules, okay. But globin protein is present. Now this globin protein, it is having two alpha chains, two alpha globins, two beta globins. Two alpha globins, two beta globins. So two alpha, two beta globin chains. Okay, two alpha, two beta globin chains. Okay. Now, even adults have different type of, one more type of adult hemoglobin, that is called as HbA2. HbA2. So in HbA2, 2 alpha, 2 delta. 2 alpha, 2 delta. Okay. So now, at the end of the day, what I want you to know is, in adult, in you and me, those whoever are listening this lecture, we are all adults, right? In adults, how many types of hemoglobin are there? There are 3 types of hemoglobin. What are they? HbF, HbA, HbA2. Out of this, who is main? Sir, it is HbA. Consists of two alpha chains, two beta chains. Yeah. So here I have discussed about the different types of human hemoglobins. Okay, Gover 1, Gover 2, hemoglobin Portland, fetal hemoglobin, adult hemoglobin HbA, A for adult hemoglobin, and HbA2. Okay, so these are the different types of hemoglobins completed, sir. Okay, different types of hemoglobins I have completed. Now, after this, I have to discuss some important points about the WBC also. Okay, right? WBC के बारे में some important points I will write. Sir, what are the granulocytes? I have discussed already with you. The granulocytic WBC. What are the granulocytic WBC? Neutrophils, basophils, eosinophils. Okay, now out of which neutrophils? Sir, if you look at a neutrophil, do you know how it's going to look like? Important points I'm speaking. So the neutrophil, the nucleus of the neutrophil, it is going to have lobes. The nucleus of the neutrophil, it is going to have these segments, multiple lobes will be there. So that's why these neutrophils are called as multi-lobated. These neutrophils will having multi-lobated nucleus. Neutrophils will be having like multiple lobes, multiple nuclear lobes will be seen. Okay, so that's one thing. And these neutrophils, what they will do, sir? During infections, neutrophil number increases and they will eat the bacteria. Sir. These are phagocytic cells. They are phagocytic cells. Neutrophils are the phagocytic cells. And what else are the phagocytic cells? What else WBCs? Not only them, monocytes. Monocytes. We have seen, right, the monocyte here. Let me show you again, and let me show you again. Here the monocytes. See, the common myeloid progenitor cell, it is going to divide into the common myeloid progenitor is going to divide into granulocyte monocyte progenitor and erythroid megakaryoid progenitor. Okay, simple. Now this granulocyte monocyte progenitor is going to further divide into granulocyte coliforming unit, monocyte coliforming unit. From here, the monocyte coliforming unit ultimately further divides into the monocyte. This monocytes I am talking about. Okay, so this monocyte. Now these monocytes, they are there in the blood. Okay. Now these monocytes, you know what they will do? They will enter into the tissues. They enters tissues. Now after entering into the tissues, these monocytes, they are called as macrophages. Now they will become macrophages, sir. Okay, they will come and they are settled in the tissue. Now the monocytes are nothing but the macrophages. Monocytes will turn into macrophages. Monocytes will turn into macrophages. Now these macrophages are present where in different tissues, in our different tissues. These monocytes are entering into these different tissues, and they are getting converted into macrophages, and in different tissues they are called as different names. Different names. The macrophages are same cells. They are present in different tissues. In different tissues, they are called with different names. In central nervous system, the same macrophage is called as microglia. Okay, microglial cells. The macrophages in the bone, they are called as, in the bone, these macrophages are called as osteoclasts. Macrophages in the liver, they are called as Kupffer cells. Macrophages in the spleen, so क्या कहते हैं? In the spleen, the macrophages are called as littoral cells. Okay, the same as in the skin, they're called as Langerhans cells. Okay, Langerhans cells. So in different places, it's the same. It's the same monocyte. After entering into the tissue, it is called as a macrophage. These macrophages in different places, they are called with different names. Okay, in the kidney, for example, in the kidney, they are called as mesangial cells. Okay, they are called as mesangial cells. So these macrophages in the lungs, they are called as dust cells. Okay, so it's the same thing. It's the same thing, but they are called with different names. That's it. Okay, so this is also completed. So neutrophils, I have explained you some important points, and monocytes, I have explained you the monocytes. They enter into the tissue, they become the macrophages. Now they are called with different names. What else you should know for your exam? Okay, so there is this one cell called as the eosinophils. Eosinophils. So eosinophils, so their number in the blood, eosinophilia, their number increases. Do you know when the number increases? So eosinophils are going to be seen more in the blood during allergies. So if you are having any allergy, for example, asthma is an allergy. Or if you are having any parasite in your body, parasitic infections. It's a parasitic. So in the parasitic infections, which cells will increase? So if you are having a tapeworm in your body, so these parasitic infections are going to increase the eosinophils. So eosinophilia or count is going to be more with allergy and parasitic infections. Okay, so this is the point which I wanted to. Okay, take it. So there is not much to discuss about the basic general points RBC, WBC इसके बारे में discuss, like there is not that much important points to discuss. Now platelets also 4 5 important points are there, sir. Okay, let me tell you platelets. So platelets, They are very, very small cells. Okay, the platelets are very, very small cells. They are 1 to 5 micrometer size. 1 to 5 micrometer. The size of the platelets is going to be 1 to 5 micrometers. Now, important point about the platelet is, do you know, almost 33% of the platelets, always the 33% of the platelets, one third of the platelets are stored in the spleen. Spleen is the site where platelets are stored, sir. One third of the platelets are stored in the spleen. Now, even platelets do not have any nucleus, no nucleus, sir. Even RBCs have no nucleus. Even platelets also having no nucleus. Okay. Now, important points which you should know as a doctor is, okay, as a first year MBBS student is, sir, inside the platelets you are having some granules. Okay, there are some granules which are present inside the platelets. These granules, okay, there are names, sir. These granules are having some names. Alpha granules, as well as dense granules. What do we call them? Alpha granules and dense granules. Alpha granules and dense granules are present in platelets. So it's alpha granules. For example, this is the alpha granule, this is a dense granule. What is exactly there in those granules? What is exactly there? Sir, in the alpha granules, the important substances which are present are, right, one, Willebrand's factor. I will discuss about this von Willebrand factor in 5 minutes. Okay, very important thing. So von Willebrand's factor is present in alpha granules. True, von Willebrand factor. Not only that, clotting factor number 5, factor number 5, as well as factor number 8 are present in alpha granules. Not only that, other substances like integrins, these are all, these integrin molecules helps during inflammation. Okay, during the process of inflammation, it will help. There is something called as WBC, like plate, uh, like adhesion. It will be helpful in the inflammatory topics. Okay, right now I don't want to go into that area. It will come in your pathology. The point which I want you to know is platelets consist of this alpha granules. Inside the alpha granules mein one Willebrand factor is there, factor number 5 is there, factor number 8 is there, integrin molecules are there, and even there is a chemical called as transforming growth factor beta. So these substances are present in the alpha granules. Dense granules may, inside the dense granules, which substances are present? So inside the dense granules, the substances like ADP, it helps in the clotting side, helps in the process of clotting. ADP molecules are there. ADP is there, and ATP molecules are there. ATP as well as serotonin. Okay, serotonin is going to be there. So ATP molecules, and serotonin molecules are going to be there. Alpha granules, dense granules. Now, after saying this, now I'll directly discuss about like what is the function of platelets, how hemostasis is going to occur. That's the main topic in this today's class. Now, imagine, guys, this is your blood vessel. Okay, now I'm going to discuss about hemostasis. Right, topic name hemostasis. I'm not talking about the homeostasis. Homeostasis is different. This is hemostasis. Like prevent the bleeding. Okay, prevent the bleeding, sir. Hemostasis, it prevents bleeding, right? Prevents bleeding. Prevents the bleeding. Okay, prevents the blood loss. Now, what happens if there is, for example, imagine I'm taking, knowingly or unknowingly, I'm taking a small blade, okay, a glass thing. Now, there is a cut, sir. There is a cut. Okay, now there is a cut. There is a damage to a blood vessel. Whenever there is a damage to a blood vessel, now what should happen immediately in that area? Blood clot should form. The blood clot should form, and it should seal the blood vessels. Prevent the bleeding. It should prevent the bleeding from happening, sir. Right? It should prevent the bleeding from happening. So, what exactly happens is, I will tell one by one. See, in hemostasis, there are two stages. Okay, there are two stages. Primary hemostasis, secondary hemostasis. Primary hemostasis hai and secondary hemostasis. In primary hemostasis, do you know what happens? The primary hemostasis is mediated by platelets. Okay, it's mediated by the platelets, and these platelets, they form the platelet plug. They form what platelet plugs there. What is this? I will explain you. Don't worry. Okay, hemostasis is primary hemostasis and secondary hemostasis is there. First, primary hemostasis will occur. During primary hemostasis, what platelets are doing? Platelets will form a platelet plug. How it will form, I will explain you. But just now, listen. Sir, in secondary hemostasis, do you know what who is involved? It's not the platelets, it's the clotting factors. Clotting factors. Clotting factors are involved. So these clotting factors, do you know what they will do? It will stabilize the clot. It will help in the formation of clots, clot formation. So what is this clot formation? Just wait. So what I have discussed with you, sir, how many stages are there in hemostasis? There are two stages, primary hemostasis and secondary hemostasis. Primary hemostasis and secondary hemostasis. In primary hemostasis, which are involved, platelets are involved. In secondary hemostasis, who are involved? Clotting factors are involved. Okay, sir, good, done. Now, whenever there is a vessel injury, okay, vascular injury, whenever there is a vascular injury, what is the first event that will occur? What is the first event that will occur? There is a damage to the blood vessel. What is the first event that will occur? What do you think? Immediately the blood vessels will undergo vasoconstriction. There is a transient vasoconstriction. That's the first event that will occur. Transient vasoconstriction. There is a transient vasoconstriction. First, to prevent the bleeding, immediately as a neurogenic reflex, immediately the blood vessel will close. Just for a few seconds, not continuously, just for a few seconds, immediately the blood vessel will close. Okay. So now imagine there is a blood vessel. Look here. Now let's put it this way. So the blood vessels are lined by, these are the endothelial cells. Okay. These are the endothelial cells here as well as on this side. Now below these endothelial cells, who will be there? Below these endothelial cells. Now I am drawing. So these endothelial cells, they are sitting on a basement membrane. That basement membrane is made up of this blue color thing. This is the basement membrane. So this basement membrane is made up of collagen. Okay, this is the subendothelial collagen. Okay, this is the subendothelial, means below the endothelium. So there is this collagen cell. So this is the subendothelial collagen. Okay, that's the subendothelial collagen. Whenever there is a damage to a blood vessel, okay, look here. Whenever the blood vessel is damaged, for example, due to some injury, now look here. This part of the blood vessel is damaged. Okay, so I'm just making a cut in this blood vessel. There is a damage in this blood vessel. See, I'm just making a damage here. There is a leak. Now there is a leak. So immediately, do you know what happens? So here is a subendothelial collagen. Here is a subendothelial collagen. It's also is somewhat damaged. It's also broken. Okay, it's also broken. So here mainly these endothelial cells are damaged. Okay, endothelial cells are damaged. Okay. Now what happens? What is the first thing? Do you know what is the first thing that's going to happen? So these endothelial cells, you should understand. Inside the endothelial cells, there are these vesicles present. There are the vesicles which are present in the endothelial cells. These vesicles are there in the endothelial cells. These vesicles are called as Weibel pellid bodies. Weibel pellid bodies. WP bodies. Okay, Weibel. Right here. Weibel pellid bodies. Weibel pellid bodies. Do you know inside the Weibel pellid bodies? Who is there? Von Willebrand's factor. So here von Willebrand's factor is there. Von Willebrand's factor. Now, whenever there is a vascular injury, do you know what happens? First, these Weibel pellet bodies, they are going to release von Willebrand's factor. See, this is the von Willebrand's factor is going to be released. Now, it's released the von Willebrand's factor. Now, this von Willebrand factor, it's like a glue. It's like a glue. Now, where it is coming and like sticking, it's sticking to the damaged area. It's sticking the damaged areas. And von Willebrand's factor is getting sticking to the subendothelial collagen. Okay. Now I have explained you. It's like a glue. So it attaches what? See, now platelets simply they are going in the blood. Previously they are simply glowing in the blood cell. Now these are not the RBCs. Even let's take them. These are the platelets. Okay, all these are the platelets. Okay, now let's take these are all platelets. Okay, so platelets are also called as the thrombocytes. These are the platelets. They're simply going. Now previously they are all going. Now in this condition, I'm just erasing them. It will deviate us from the topic. Now, do you know what happens? Now, whenever von Willebrand factor is leaked, these platelets is coming and binding with the von Willebrand factor. See, now there is this one structure. It's having, now it's going to give a handshake. It's going to come and give a handshake with the 1 milliprint factor. See, these platelets are coming and they are coming and binding with 1 milliprint factor. Okay. So this step is called as platelet adhesion. So platelets are attaching with the 1 milliprint factor, platelet adhesion, with the help of this molecule. So do you know what is the name of this molecule which I am just putting over here? This molecule, it is called as GP1A. GP1A, the name of this molecule is called as GP1A. With the help of GP1A, with the help of GP1A, the platelets are attaching with 1 milliprint factor. They are attaching with 1 milliprint factor. Okay, sir. Okay. Now, platelets previously they are sleeping. Now they are activated. Now they understood there is some damage occurred to the blood vessels. Now they are activated, sir. Now they are activated. Now, what they will do? Now they are activated. Now inside these platelets, now there is will be a shape change. Now shape change will occur. Now these platelets, these activated platelets, now do you know what they will do? They are calling their friends. Okay, they are shouting and they are calling their other friends, platelet friends. And platelets come here. There is some damage happening over here. Okay, we have to seal this area. We have to seal this area. So platelets are producing a substance called as thromboxane A2. Okay, as well as they are also releasing ADP. Okay, now the platelets are releasing ADP and thromboxane A2. Now this ADP and thromboxane A2, do you know what they will do? Now they will go and call the other platelets to come. They will go and call other platelets. All the these are going to call the platelets. Okay, so now what happened? I'm just erasing these molecules. I'm just keeping this molecule side over there. For example, let's keep it here somewhere over here. Okay, don't forget about them. They are important molecules. Now, whenever these molecules are released, okay, whenever these molecules are released, ADP and thromboxane A2, now newer platelets will come here. Newer platelets are coming, and these newer platelets are going to join with these platelets. See, already the platelet adhesion completed. Platelet adhesion completed. Now, it's a new platelets, they will bind with each other. So now, one platelet is going to bind with the other platelet. Okay, now they go. The one platelet is going to bind with the other platelet with the help of these molecules that I'm drawing. See, there are these molecules. Now they're having many hands. Now they're tightly binding with another. So this process is called as platelet aggregation. These are other platelets. These are all other platelets. So this process, like no, one platelet is attached with other platelets. So many platelets will come here. It's going to attach with the other platelet. Something like this. Okay, this is called as platelet adhesion. Sorry, platelet aggregation. Sorry, platelet aggregation. Now, question is, sir, what are these hands? Multiple hands are there. So, what is that molecule which is helping in platelet aggregation? This molecule, this is not GP1A. This is called as GP2B3A. This molecule is called as GP2B3A. With the help of this molecule, which is called as GP2B3A, there will be platelet aggregation. Platelet aggregation. So first, 1 milliprint factor is released. Now to the 1 milliprint factor, platelets are getting attached. That is called as a platelet adhesion. Platelet adhesion occurs with the help of GP1B. After platelet adhesion, there will be platelet aggregation. So thousands and thousands of platelets will come to that area and will try to seal this area. Will try to seal this area damage. So what they are forming? They are forming platelet plug. All this together it is called as a platelet plug. So my question is, sir, these are just platelets. Okay, these are just bricks, sir. Now you are trying to build a wall with the bricks. Do you think it's going to be strong enough? No. You have to put cement between the bricks. Then only it will be strong enough. In the same way, first platelet. This is the primary hemostasis. So far, what I have discussed is the primary hemostasis. So platelet adhesion, platelet aggregation. So it's forming a platelet plug. But this is weak. Platelet plug is going to be weak. It cannot completely seal the blood vessel. Now, after primary hemostasis, now who should start? Secondary hemostasis. Now, clotting factors should be acting. Now, these clotting factors are like a cement. They are like a cement that they will make the platelet plug strong, totally seal the blood vessel. Okay, now you understood. So now what happens is secondary hemostasis will occur. But before going any further, let me tell you in exam how they will ask you questions. Sir, if I am having deficiency of von Willebrand factor, if I am having deficiency of the von Willebrand factor, now platelet adhesion is not going to occur. Platelet aggregation is not going to occur. Platelet adhesion, aggregation problem. See, the sequence of events are not going to occur. So what will happen? So von Willebrand factor deficiency is going to cause bleeding. It's going to cause a bleeding disorder. So there is a disease called as von Willebrand's disease. Okay, von Willebrand's disease. In the von Willebrand's disease, there is deficiency of von Willebrand factor. So these patients are going to have bleeding. Bleeding into the skin, you can see there, these patients are bleeding, sir. Bleeding into the skin, bleeding into the joints. Now, if there is GP1A defect, okay, there is a defect in GP1A. The GP1A is defective. Now, which process is going to be affected? Platelet adhesion. Platelet adhesion. Platelet adhesion is going to be defective. GP1A defect. Do you know what is the name of the disease called as? Bernard Solier syndrome. Okay, so Bernard Solier syndrome, sir. So, what exactly is Bernard Solier syndrome? So, Bernard Solier syndrome is a defect in GP1A. The GP1A defect or absence. So, the platelet adhesion is going to be impaired. So, no platelet plug formation. If the platelet plug is not there, immediately clotting will not, platelet plug is not there. The sealing of the blood vessel is not going to occur. So, what happens? Again, bleeding. Again, bleeding, sir. Bernard Solier syndrome, bleeding problem. Now, GP2B 3A, GP2B 3A defect. Again, what's the problem? Platelet aggregation problem. Platelet aggregation. Platelet aggregation problem. So, what is this disease? The disease in which GP2B3A is defective. This is called as Glanzmann thrombosthenia. So, Glanzmann thrombosthenia, sir. So, Glanzmann thrombosthenia is a condition in which GP2B3A is going to be defective. Bernard Solier syndrome is a condition in which GP1A is defective. Okay, you understood? So these are the points which I want you to know. Bleeding problems. These are all the bleeding problems. Now, clotting. A clotting, what exactly is this a clotting, sir? How clotting occurs? Right? Clotting. Secondary hemostasis, I am talking. Clotting. See, in your first year, right? You haven't even joined your MBBS. Let me make it as simple as possible for you. Clotting factors. In our blood, there are proteins called as clotting factors. How many clotting factors are there? So there are 12 clotting factors. Okay, there are 12 factors. 12 clotting factors are there, but the sixth clotting factor is absent. Even after absence of the sixth clotting factor, there are 12 clotting factors because totally, if you look 1, 2, 3, 4, 5, 7, 8, 9, 10, 11, 12, 13. Okay, but if you look normal, if you look at the number, it will come like 13 clotting factors are there, but sixth clotting factor is absent. So total number of clotting factors are 12 only. 12. 1, 2, 3, 4, 5, 7, 8, 9, 10, 11, 12, 13. Sixth clotting factor is not there. So what is the function of this clotting? क्या है? What exactly is this clotting? In clotting, during clotting, so there is a protein clotting factor number one. Clotting factor number one that is called as a soluble fibrinogen. Soluble. It's normally soluble in the blood. So soluble fibrinogen. The soluble fibrinogen, it is converted. It have to be converted into. So they go insoluble fibrin. Insoluble fibrin means fibers, fibrin, insoluble fibrin, strands. Now fibers are going to come, sir. Now these fibers are going to completely seal the platelet plug. Okay, so now what happens is, sir, this is the last step. Last step, sir. The soluble fibrinogen should be converted into soluble fibrin. That is the purpose. That's the whole purpose of clotting. How it will occur? Let me tell you how it will occur. So there are different types of clotting factors are there in your body. 1, 2, 3, 4, 5, 6, 1, 2, 3, 4, 5, 7, 8, 9, 10, 11, 12, 13, 6 is not there. Now, look. Sir, actually, if you look at it, if you go through your books, it's very hard, sir. It's very hard. There will be two, three pages will be there, hemostasis. Let me make it as simple as possible in 5 minutes, under 5 minutes, how to understand the clotting cascade. Now, okay. Now your blood vessel is damaged. First, blood vessel is damaged. Some damage to the blood vessel. Okay. So now subendothelial collagen is exposed. Now this endothelial collagen, now it is touching. Now it is touching into the blood. Or let me put it this way. You will understand. See. First, always write 10 in the middle, sir. Always write 10 in the middle. What is this 10? Clotting factor number 10. Okay, always write 10 in the middle. Sir, how many clotting factors do we have? 12. So write 12. So what is the number before the 12? 11. Before the 11, what is the number, sir? 10. It's already written over there. Before 10, 9. Before 9, 8. Before 8, 7. 7. Sir, in the middle, what is there? 10 is there. Sir, 5 twos are how much, sir? 5 twos are. 5 twos are how much? What happened? Happened, sir? Is there some issue? Just wait 1 minute, guys. 1 minute. I'm getting connected. Hello. అది ఎయిర్ సెరమన్ వచ్చేసింది అక్కడ బ్లాక్ కలర్ లో uh, ఏం చేయాలి? యాక్సెప్ట్ చేసి. Started? Hello? వీడియో పాస్ అయినట్టుంది. ఇలా స్ట్రక్ అయిపోయింది. Now, okay, guys, can you hear me? Can you hear me and the screen at a time? Okay, shall I? Now, okay, guys. Okay. Now, okay. So, what we are discussing, write the clotting factor number 10 always in the center. Okay, so there are 12 clotting factors. Before the 12, there is letter 11. Okay, number 11. Before 11, there is 10 already written over here. So 9, 8, and 7. Completed. Completed. Now tell me 5 twos are how much? Sir, 5 twos are 1. Sorry, 5 into 2 into 1. Okay, 5 twos. 5 into 2 into 1. How much? 10 only. Okay, something like that. 5 into 10, 5 into 2 into 1. 5 into 2, 10. 10 into 1, 10. So here they go. This pathway which I have shown you, This is called as intrinsic pathway. It's intrinsic pathway. So this pathway which I am showing you 7 and 10, this is extrinsic pathway. Extrinsic pathway. Intrinsic pathway है और extrinsic pathway. Intrinsic and extrinsic pathway. So this pathway which I am showing you in the center 10, 5, 2, 1. This is called as common pathway. It's a common pathway. Okay, it's a common pathway. So intrinsic pathway, extrinsic pathway, and common pathway. Now some students will have it out, sir. What we can't understand what is this intrinsic pathway, extrinsic pathway, and common pathway. Listen. Now look, whenever your blood vessel is damaged, okay. Now normally in the blood, all the clotting factors are inactive. They are sleeping. They are sleepy. But whenever your blood vessel is damaged, okay. Now subendothelial collagen will be there. No, endothelial collagen in the blood vessels. Now that subendothelial collagen, it will activate the clotting factor number 12. Imagine clotting factor number 12 is sleeping. It's sleeping. Now the subendothelial collagen activates first 12. So right, the subendothelial collagen is going to activate the clotting factor number 12. Once 12 is activated, 12 activates 11, 11 activates 9, 9 activates 8, 8 activates 10. 10 activates 5, 5 activates 2, 2 activates 1. So what is this 2 and 1, sir? These are 2, important. 2 is called as thrombin. Thrombin, clotting factor number 2 is called as a thrombin, clotting factor number 1 is called as a fibrinogen. So, what it is doing, what this thrombin is doing, once the thrombin is activated, now this thrombin is going to convert inactive factor number 1, that is soluble fibrinogen into insoluble fibrin. So the soluble fibrinogen is going to be converted into insoluble fibrin. 2 is going to convert soluble fibrinogen into insoluble fibrin. Simple, sir. So this insoluble fibrin, it is forming the clot. It's like a cement. It forms the clot. Now the cement is being added onto the platelet plug. Now it will become hard. Okay, now it seals the blood vessels, sir. Okay, so now you understood the intrinsic pathway. So subendothelial collagen is going to activate 12, 12 activates 11, 11 activates 9, 9 activates 8, 8 to 10, 10 to 5, 5 to 2, 2 to 1. Okay, so take it. Then what exactly is this extrinsic pathway? Extrinsic pathway क्या है? What exactly is this, sir? देखो, sir, extrinsic pathway. Look, extrinsic pathway. This extrinsic means outside. Extrinsic. Intrinsic means inside. Extrinsic means outside. Outside means what? So outside means the tissue. Whenever there is a damage, for example, imagine there is a damage. Whenever there is a damage, not only the blood vessel is injured, not only the blood vessel is injured, but the surrounding tissue is also injured. Now from the damaged tissues, okay, from the damaged tissue, there is this one substance that going to leak. There is that one substance that going to enter into the blood vessel cell. From the damaged tissues, right here, damaged tissues, there is this one substance that's going to leak. That is called as the tissue factor. Tissue factor. Now this tissue factor is going to activate the factor number 7. The tissue factor is going to activate the factor number 7. Now factor number 7 is activated. 7 activates 10, 10 activates 5, 5 to 2, 2 to 1. Now this tissue factor is also called as factor number 3, clotting factor number 3. Okay, so now who are involved in extrinsic pathway? Which clotting factors are involved in extrinsic pathway? 3, 7. Which clotting factors are involved in intrinsic pathway? 12, 11, 9, 8. Which clotting factors are involved in common pathway? 10, 5 to 1. 10, 5 to 1. Intrinsic pathway is activated by subendothelial collagen. Extrinsic pathway is activated by tissue factor from damaged tissues. Okay. Now, questions which were asked. Okay, questions which were asked. For example, deficiency of factor number 8. If you are having factor 8 deficiency in your body because of some reason, factor number 8 is not there. When factor number 8 is not there, which pathway will be affected? Intrinsic pathway or extrinsic pathway? Intrinsic pathway of clotting will be affected. When you are having deficiency of factor number 7, extrinsic pathway is affected. In the recent FMG exam, okay, in the recent FMG exam, last FMG exam, this question was asked. Factor number 7 is involved in extrinsic pathway. Extrinsic pathway. Done. I hope you have studied in your class 10th, 11th, and 12th. So, there is one vitamin, one important vitamin which is helping in the clot formation. Important vitamin, sir. Do you know what is that important vitamin? Vitamin K. Vitamin K is involved in the clotting. So, how it is involved in the clotting? What exactly it is doing? Okay, sir, what indicated by PT and PTT? Akhil Thota, you are asking what is PT PTT? अरे देखो, Akhil, as you are asking, I am telling you. See, PT PTT क्या है? Akhil Thota is asking in the comment section. What is PT PTT, sir? Look, this intrinsic pathway is happening, right? 12, 11, 9, 8. 12 is activating 11, 11 is activating 9, 9 is activating 8, 8 is activating 10. That's intrinsic pathway, sir. How much time it will take? How much time it will take? That is time. The time is measured with steady. Intrinsic pathway, how much time it is taking. Extrinsic pathway, how much time it is taking. There are two studies called as PT, PTT. These are the times. PT means what? Prothrombin time. What is PTT? Partial thromboplastin time. PT and PTT, they are the times to measure the intrinsic pathway and extrinsic pathway. Now tell me, sir, here you are having two studies, PT study and PTT study. They are the times, time. Now, PTT is a big name or PT is a big name? PTT is a big name, sir. Big name PTT, partial thromboplastin time. Which pathway is bigger pathway? Intrinsic pathway or extrinsic pathway? Intrinsic pathway. So, intrinsic pathway is measured with PTT. Extrinsic pathway is measured with PT. PT. So prothrombin time, it calculates the time for extrinsic pathway. PTT is a time calculating the intrinsic pathway. How much time is taking? Partial thromboplastin time and prothrombin time. Okay. Now try to answer Akhil Tota. Now you try to answer. Sir, if you are having deficiency of factor number 8, factor number 8 deficiency, which time is going to be elevated? Which time? PTT time is going to be elevated. It takes a lot of time. It takes a lot of time for the intrinsic pathway to happen. Deficiency because factor number 8 is not there. Deficiency of factor number 9. PTT time will be elevated. The same way, if you are having deficiency of factor number 7, PT time will be elevated. So PT and PTT, they are the time periods to measure intrinsic pathway and extrinsic pathway. I hope you have studied that vitamin K is very much important for clotting. How, sir? See, this vitamin K helps in activation of factor number 2, 7, 9, 10. In your MBBS, in your biochemistry, you will study this. Sir, vitamin K, do you know what it will do? Sir, this vitamin K, it will help in a process called as gamma carboxylation. Gamma carboxylation. It helps in gamma carboxylation of factor number 2, 7, 9, 10. Vitamin K causes gamma carboxylation of factor number 2, 7, 9, 10. So this factor number 2, 7, 9, 10, they are activated. Now they are activated, they help in clot formation. If you are having vitamin K deficiency, 2, 7, 9, 10 are not activated. So which pathway will be affected? Intrinsic pathway will be affected or extrinsic pathway or common pathway? All three will be affected, sir. Because 2 is involved in common pathway, 7 is involved in extrinsic pathway, 9 and 10, 9 is involved in intrinsic pathway, 10 is involved in common pathway. All pathways will be affected. Now clotting is not going to occur. If clot formation is not there, there is a chance of bleeding. So that's why vitamin K deficiency will cause what? Bleeding. Vitamin K deficiency cause bleeding. Why? Vitamin K normally helps in activation of gamma carboxylation of factor number 2, 7, 9, 10 so that they are now functional. They are activated. When vitamin K is not there, 2, 7, 9, 10 are not going to be activated. Okay, that's the problem, sir. Okay, you understood? Now I hope you understood. Okay, so that vitamin K completed. Now after this, I want you to add one more integration here. I want to add one more integration here. Have you ever heard about a drug called as warfarin? Warfarin. Have you ever heard about drugs like warfarin, heparin? Warfarin, heparin. Sir, what is warfarin? It is anti-clotting. Anti-clotting. It inhibits the clot formation. Okay. It inhibits the clot formation. It stops the clot formations. It inhibits the clot formation. Warfarin. Okay. It inhibits the clot formation. How this warfarin is going to work, you know? Sir, warfarin in the war. War. Okay. The first word, say war. Think like this. Think like this. In which patient we don't want any clots? See, heart patients, sir. Heart patients. already in their heart, sir. Now imagine this is the heart. Okay, now let's take a heart patient. Now I'm showing you one blood vessel. Okay, this is the coronary artery of the patient. Coronary artery of the patient. Now already here the patient is having atherosclerotic plaque. Some fat is there. Atherosclerotic fatty plaque is there. Okay, now do you know this today or tomorrow? Definitely, what happens is this clot is going to rupture. Okay, or I should say that atherosclerotic plaque, the atherosclerotic plaque is going to rupture. When it is ruptured, you know what happens? First, platelets will come to this area. Platelet adhesion and aggregation will occur. Once platelet adhesion and aggregation is occurred, now here clot formation will occur. So now this clot, it will grow, it will grow, it will grow, and it will form what? Sir, it will completely close the blood vessel. It will completely occlude the blood vessel. Due to this clotting, intravascular clots. Due to this intravascular clots, the patient can have myocardial infarction. Heart attack will occur, sir. So now in these patients, we don't want to have any clots. We don't want to have any clots. So who will stop the clot formation? A drug called as warfarin. Warfarin is anticoagulant. Coagulation is not going to occur. Clotting is not going to occur. Anticoagulants, sir. Coagulation cascade. Clotting cascade is not going to occur. Coagulate means clotting. Okay. So warfarin. Do you know what it will do? Warfarin during war. I used to remember. War में क्या होता है? Killing. War में killing, sir. Killing. So killing. Warfarin inhibits what? It inhibits vitamin K. When vitamin K is inhibited, what happens? Sir, factor number 2, 7, 9, 10 are not activated. When factor number 2, 7, 9, 10, whenever they are not activated, do you think clotting will occur? Intrinsic pathway, extrinsic pathway, common pathway, they are not going to occur. So clotting will not occur, sir. Clotting will not occur. Okay. So warfarin, it is anticoagulant. Anticoagulant. Okay. Now, most of your parents might be using a drug called as aspirin. Have you ever heard about aspirin? So these heart patients, especially who are having blocks in their heart, okay, who are having blocks in their coronary arteries, they'll be using a drug called as aspirin. Have you ever heard? Okay, what is this aspirin doing, sir? Aspirin, it is antiplatelet. It's a antiplatelet. It's an antiplatelet. Do you know what it will do, sir? Aspirin, it inhibits platelet aggregation. Platelet aggregation. So whenever you are taking aspirin, you know, platelet aggregation is inhibited. Platelets will not now attach with each other. Platelets will not attach with each other. So now platelet plug formation, primary hemostasis followed by secondary hemostasis will not occur. Will not occur, sir. Otherwise, imagine I'm a heart patient. I'm having a block in my coronary artery. Already there is block. If you have further clot formation in my coronary arteries, because that atherosclerotic plaque is ruptured. When the atherosclerotic plaque, when it is ruptured, immediately platelet adhesion, platelet aggregation. What will happen? Now there, the platelets. Imagine this is my artery. Now that atherosclerotic plaque is ruptured. That plaque, okay, it's ruptured. So immediately platelets will start to come adhesion, platelet aggregation. When the platelets are aggregating, there is a chance that it can completely block the blood vessel. It can completely block the blood vessel. So totally blood supply to the heart is decreased. So heart will die. Myocardial infarction can occur. So what you have to do every day, this patient, they go. These heart patients, every day, what they are taking? They are taking antiplatelet drug, that is aspirin. Till the time he is taking aspirin in the body, platelet adhesion, especially platelet aggregation is not going to occur. When the platelet aggregation is not there, that platelet plug or that thrombus, and the thrombus is the clot is not going to occur form. Okay, here I have discussed about the two important drugs. That's the action of aspirin inhibits platelet aggregation, warfarin inhibits vitamin K. Both of them, this is inhibiting the clotting. Warfarin is anti-clotting, aspirin is anti-platelet. Aspirin inhibits primary hemostasis, warfarin inhibits secondary hemostasis. Warfarin is acting on the clotting system, aspirin is acting on the platelet system. That's platelet aggregation. So with this, I have completed the hemostasis also, the basic understanding what you should know regarding the hemostasis, primary hemostasis, secondary hemostasis, and also I have explained you about how the hematopoietic stem cell, one single hematopoietic stem cell is going to form all the blood cells. Okay, from one single hematopoietic stem cell, which is a multipotent in nature, it will produce RBC, WBC, platelets. Okay, everything, sir. Everything. Okay, so in detail specific small details you can study in your MBBS. After joining your MBBS you can like go through them. So as the joining student of MBBS, if you know this much, it will help you to further understand the concept in your first year later. Okay, okay guys, hope the class is helpful to you. You understood the class. Okay, done. We are done with the blood physiology. Hope the class is helpful. Thank you. See you in the other classes soon. Okay, bye bye. Bye bye for today, guys.